January is Cervical Cancer Awareness Month, and this morning we're talking about the disease and prevention. Joining me now is Dr. Tankou. She is an oncologist at St. Francis Hospital. Thanks so much for being with us.
My pleasure. Thanks for having me.
All right, so let's start with the basics. What is cervical cancer?
Right, so cervical cancer is a cancer that starts in the cells of the cervix, right? The cervix being the very bottom part of the uterus that connects the vagina to the upper part of the uterus. The good news is that we've made huge strides when it comes to reducing the prevalence of cervical cancer in this country. However, there's still about 14,000 women every year diagnosed with cervical cancer in the United States. Therefore, the importance of talking about this topic and the importance of this awareness month.
And as with any cancer, the importance of early detection is really key.
Absolutely.
And the best way to do that, regular checkups, regular visits with your gynecologist. But
That's
talk
exactly
about
right.
the frequency and the guidelines for that, because they've sort of changed in the last 5 years.
Exactly. The guidelines have changed. So just as a reminder, every woman should get started with pap smear screening at age 21. Then it's every 3 years until age 29. Starting at age 30 and until about age 65, women should get both pap smear and HPV testing every 5 years. And if the testing is normal, you stay at those intervals. However, if the testing is ever abnormal, there is follow-up testing, and then those intervals get shorter.
Now, you did mention HPV, so I'd like you to talk about the HPV vaccination.
Yeah.
Because that's really key as well.
Absolutely. So, I say that, one of my hope is that as a gynecologic oncologist, I will be out of a job someday, at least when it comes to cervical cancer.
Right,
because it is preventable. And most cases are completely preventable. And one of the ways is, the human papillomavirus, or HPV, is the virus that causes the changes that lead to cervical cancer. And so vaccination, or the Gardasil vaccine, which is an HPV prevention vaccine or a cancer vaccine, can essentially prevent the acquisition of the virus to begin with, and therefore the development of cervical cancer. And so it's a vaccine that's preventative. So it's recommended for people to get prior to first sexual contact. So it's going to usually be younger girls and boys. Recommendation is age between 11 and 13, ideally before age 15. We've seen reduction in rates of cervical cancer in vaccinated women of 65%.
And this vaccination is a one-dose vaccination.
It's a one-dose vaccination, that's right, for that age group.
I'll talk a little bit about symptoms that women should be aware of.
That's right. So, Erica, like most early cancers, they can tend to be pretty asymptomatic really early on, which is why, again, coming in and getting screened can allow us to detect precancerous or early cancer changes and treat it, with a pretty, minor procedure. As it gets more advanced, women can develop abnormal bleeding. So that's going to be bleeding in between menstrual cycle or bleeding after intercourse. If it progresses even more, there can be symptoms like, really bad pelvic pain or back pain or even blood in the urine. So those would be things to definitely seek care and see a healthcare provider about.
All right, so the main takeaways here: get your HPV vaccination and see your gynecologist regularly.
That's right. And maybe there'll be a day where we can eliminate this cancer once and for all.
We certainly can hope. Yes, Dr. Tankou, thank you so much for being with us.
Thank you for having me.
We do appreciate your time.